Takes just a minute. All right. Hi, everybody. Welcome to our monthly Facebook Live event. I am Dr. Sonia McGowan. I am the owner of the Covenant Pediatric Wellness Center in Jefferson City. And I am so excited today because I have one of my very favorite people. I probably say that every month because I only bring on people who I love, but literally, this is Glenn Wilhelm. He is the sales director for NeuroCure, but he's also my friend and colleague. We have known each other for a really long time, but he's here today to talk about NeuroCure, which is a company doing some really fascinating work around early autism risk identification through a test called the ASD Insight. So, Glenn, welcome. I'm so happy you're here.
Well, I am absolutely thrilled to be here. And ASD Insight, it's the first of its kind test. And literally, we can detect autism risk within days of birth, right? Which is something that's never been done before. And so we're going to get all into that. But first and foremost, I just kind of have to brag on one of my favorite practitioners. So if you guys don't know how awesome Dr. Sonia McGowan is, I've known you, I think, roughly about a decade.
Yeah.
I know I've been to probably 25, 30 autism conferences and other conferences. And Dr. McGowan she's MAPS trained. She teaches all these other providers. So just to be here with you and to know you. And Dr. McGowan, let me ask you, how many, just in your current business, Covenant Wellness, how many kiddos do you think have come in and out of your doors that you've worked with?
I would say, so I opened in May of 2017, and I think our current patient roll, if we were to make a list of everybody, probably between 7,000 and 8,000 kids. Not all have had autism, but probably 99% of them have autism or some sort of complex need similar to that.
Yeah.
So wow. I have seen my share of kids on the spectrum.
So just a little bit of experience, is that what you're telling me?
Yeah, just a little bit.
That's awesome. So, I kind of start this out with not what ASD Insight is kind of a story that I think we both can relate to. And I've probably met, I don't know, thousands of families where they have a child diagnosed, and it all kind of starts this way. They go in and they see their provider, regardless of provider, and says, man, something just doesn't seem quite right. And we're not really sure what to do. And well, hey, some kids just develop a little bit later than others. So wait, come back and see me 3 months or 6 months. And you do that. And it's like, well, some kids still, let's give it another 6 months. And we're missing all this opportunity for what I call early intervention. Does that ring a bell to you? I say even personally with your background.
Yeah. So it definitely does, because my son, who was born in 2005, he's soon to be 21, but he had kind of a hard beginning. He had a lot of skin issues, a lot of bowel issues. He never slept. He had language delay. He had a lot of gross and fine motor delays. And I literally took that boy everywhere. Starting at about a year old, I took him pediatricians, chiropractors, naturopaths. I mean, literally, you name it. And I was always sort of patted on my head and told a couple of things. I was told, number one, I was a helicopter mom, and that's why he had, 27 diarrhea diapers a day and wasn't talking. And the really good one was, yeah, he's covered in eczema and he doesn't sleep and he has, chronic explosive diarrhea because he has an older sister. Yeah. And so everybody was just like, let's wait and see. Meanwhile, he got worse and worse over time until, I was able to figure things out. But, my experience with my son is what drove me to open the practice I have now, because I remember feeling hopeless and lonely and thinking, what's going on? Why can't I figure out what's wrong with my kid? And I swore that if I was ever in a position to help other people not feel so alone, that's what I was going to do. And so one of the things I really remember is always being told, it's fine. He's a boy. He has an older sister. Give it 6 months, give it 3 months, whatever. And so one of, sort of the objectives we've adopted here is we don't wait. We don't wait 3 months. We don't say, let's wait and see what happens in 6 months. We don't do that. And so that's part of the reason why I'm so intrigued with the ASD Insight test, because we can get right to it.
Yep. So in those moments where we're waiting and we know something's up, but we don't know what to do. I mean, that's really what ASD Insight was made for. I mean, this test was 8 years in the making. Our chief science officer, Dr. John J. Gargis, he led UC Irvine's CART program, which is a Center for Autism Research and Translation. He had 60 scientists and developed all this, and literally what we know. And I kind of want to make this very, very simple, is we have this calcium ion channel in what we call the IP3 receptor. Calcium stores and it needs to be released into the cell. And what happens, and we know, kind of put it simply, there's this gating dysfunction, if you will. Mm-hmm. So this calcium stores in a neurotypical, right, that channel opens and that calcium gets released into the cells, and this is all our cells. And what happens, what we know, kids who end up with that diagnosis, is that calcium accumulates, that gate starts to open and it collapses. So we're not getting that full release into the cell. That can affect everything from neurotransmitter release, right, our mitochondria function, mm-hmm. immune T and B cell responses, even gut mobility and secretion. I mean, this is everything. And so this is dramatically different than other testing. Number one, it's not observational, it's functional, right? This is actually what's going on, right, at the cellular level. But it's not an antibody test. It's not, we're not looking at genetic testing, and none of those are bad, but this is literally what is actually going on with the child. Did I break that down okay?
I'd say you did amazing. So one of the things that I have preached from the mountaintops for years is that there is a list of common physical, biochemical traits that we see in complex kids, particularly kids with autism. In almost every case, we see intestinal problems, right? They're not good poopers. They're not good at digesting. They're not good eaters, right? We also, across the board nearly, see mitochondrial dysfunction. We see neurotransmitter disruption, right? So all the things that you listed are the things that we see in kids with autism and other complex needs. And so if everything boils down to this IP3R channel, why wouldn't we test it now and say, okay, there's a vulnerability here. Let's make some decisions that align with what those vulnerabilities are.
Yeah. I mean, and you think about it, we always look what was going on in the brain, super important. I mean, a child's brain, right, forms over 1 million new neural connections every second, right, in early years. And what we know, kind of breaking this down, that when that gating doesn't work correctly, right, the neurons, right, it's distorted. And that distortion affects how the neural connections are formed. They're strengthened, right, weakened, or even synchronized. I mean, but it's not just here. It's literally right. Every aspect.
So how is this test different from traditional autism screening tools that rely on behavior, developmental milestones, et cetera?
Right. Yeah. Right. And I mean, typically diagnosis occurs if you can get somebody to do it within that 18 to 24 months. And that's kind of the ADOS, which is the gold standard. But we know even today, the typical diagnosis occurs between age 4 and 5. Age 4 and 5.
Yeah.
So many people want to do testing. It's observational. It's like, and this is where we get into your subjective viewpoint, because one may have one opinion, one may have a differing opinion, It's like, well, I didn't really see it. And it's like, well, you're not in my everyday. There's a lot of variables.
Right.
Well, from a functional aspect, right, biology based, we know this is physically occurring. So we're taking that subjectivity out of the equation.
So all along the whole history of autism, its diagnosis has been behaviorally defined.
Right.
And I have parents tell me all the time that, I went to this doctor. He never really touched my kid. He watched him for about 9 or 10 minutes and then came back and said, "Oh yeah, he's level 3 autism," or, "Oh no, I don't see any signs of autism at all," in, a few minutes. And
Right.
we all know that kids are variable, right? They'll be this way today and that way tomorrow. So much of it depends on, did they have a nap that day? Have they, are they constipated? How's their behavior based on today? And so what I love is that this test takes, like you said, it takes the subjective part out and it says, here is the risk. It's objective. Here is the data.
Yeah, and oftentimes the tests are observed outside their normal environment.
Right.
So are we much more calm? I mean, you are right. It's the variables.
Yeah. So when we say autism risk as it relates to this test, what do we mean?
Yeah. So what we know is we are able, and this is where we talk about sensitivity as well as specificity, hardest word for me to say in the English language right there,
Right.
is we are not going to catch everyone who has this gating dysfunction. We're gonna capture about 80%. So, and we don't know why that we don't, and we're using 3 Nobel Prize winning techniques. I mean, there's no other test like this in the world. And so we're going to catch, like I said, about 80%, but we won't catch everyone. But one thing we're not going to do is we're not going to come up with, quote, false positives. This test is not a negative or a positive. It is autism risk identified. The risk has to do with what we're looking within the IP3 receptor.
So if there is a dysfunction in that IP3 calcium channel gate,
correct,
then you have an autism risk.
Yeah, absolutely.
Got it.
Now, this test can be done literally, this is where it's a complete game changer, can be done within days of birth. I mean, literally, you can take a discarded foreskin, and we need a skin sample. It can be done at 1 month or 3 months or 6 months or 3 years. And hey, I have a teenager. And I want to know. I mean, it can be done on teenagers as well.
Okay.
If need be. And that's where it's a complete game changer, because right now, I mean, I'm going to ask you, just where you live, how long does it take for somebody to even get in? And I mean, there's one Dr. Sonia that I know doing exactly what you do.
Right.
But take out what is everybody else? What are your patient base doing right now?
Right. So there is a well-known autism center just a little bit north of me, and I think patients are being told there's a wait of a couple years right now. And yeah, so it's if you could know right away, there are lots of decisions. I know, had I known, I mean, my son never had an autism diagnosis, but he was complex. He's okay now, but had I known what his risk factors were, I would have made many different decisions for him in terms of his environment, his food, medical procedures, things like that.
Right.
So the earlier, the better, for sure.
Oh, absolutely. I mean, we know literally intervention starting at age 2, and just through therapies alone has proved IQ difference of up to 17 points. I mean, that's the difference potentially, depending on where we are in the spectrum from not working and having a job.
Right.
I mean, and that's through your traditional therapies. And we're to the point, unfortunately, that 1 in 31, right, our kids in the U.S. are diagnosed. And
where's the outrage and the protests for that, right?
Yeah.
Don't even get me started. So you mentioned the skin sample.
Yeah.
So I know that, especially with the new baby, even with a toddler, parents are very, they just want to make sure that they're not hurting their child. Tell us more about what that skin sample is about.
Yeah. Skin sample for red flags. You're gonna what skin sample from my child? Um, so this is called a skin biopsy. Biopsy is a scary word. Literally a skin sample. I'm gonna show you this. This is what we call a punch biopsy. And I don't know how big you. I'll put it in perspective. Here's my pen. You look at the head of the pen, and you look right here. It's 3 millimeters. It's tiny. It's hard for me to use adjectives, but
Yeah.
when we're looking at a smaller than a ballpoint pen, getting a collection is easier than doing. Let me ask you, you're the expert. How hard is it to get a blood draw?
Gosh, depending on their age, it can be a 4 or 5 person job.
Right, right. This is easier than a blood draw. It takes just literally a minute. There's no sutures needed. So
And you can use some topical pain prevention too.
absolutely. So there's a topical numbing. Some providers are going to, you can actually get a shot of lidocaine just to numb it, right? They're not going to feel anything. Typical Band-Aid goes over, and I mean, that's it. Very simple procedure.
And so if the family is seeing a doc who maybe doesn't, within their scope of practice, cannot do a biopsy,
Yep.
what other options are there to collect that sample?
So we have a nationwide relationship with a mobile nursing provider that will literally come to your house and get the skin sample. So you don't even have, and you know this growing up, right? Taking your child somewhere else, that's an event all of itself. How beneficial would it be to you as a mom to have somebody come to your own home where you're not stressing your child out by going to all the other factors that involve a typical office visit?
Right. Yeah, that's super valuable to just have someone just come to your house and take care of it.
Right.
So we know it can be a skin punch biopsy. We know if the child is being circumcised, you can use that as the sample. So what is the investment in terms of what families would pay for this test?
First off, before we do that, a common question is, hey, where are we doing this? Typically upper thigh.
Upper thigh.
Okay. And very, it's probably the most common place to do that.
Okay.
So investment. We're not with a new diagnostic. We're not covered by insurance yet, which nobody is initially. Our goal is to get there. We've tried to price this as much as we can. As you can imagine, this is 8 years in the making, bringing any new diagnostic to market. The investment for the test is $949.
Okay.
Which is much lower than many other diagnostic out there, and this is for a functional assay. Now, that being said, I kind of like to put that on you based on the information that ASD Insight provides compared to some of the other diagnostics, whether it's antibodies or it's a genetic test or some of the other tests that you run within your community. How would you rate the value of this test?
I mean, it's valuable to me in terms of allowing a family to be proactive. So if you can determine that your child has an increased risk, right? It's going to change some decisions that you make that might sort of create that diagnosis inevitability, right?
Right.
So if you end up with a child with a diagnosis of autism, the out-of-pocket costs are astronomical, even if you have insurance, between lost wages at work, right? Or maybe sometimes lots of moms just have to stay home and creates a one income family, but also all the therapies, speech, OT, PT, all the testing, all the diagnostics. I mean, how do you even measure that? And so if you can determine that there's an increased risk, you can change the trajectory, right? Based on the decisions that you make for that child. Maybe you're avoiding all those thousands and thousands of dollars of diagnostics and therapies and special
Right.
schools and ABA and whatever else.
Well, personal experience, and I know there's one-offs that always occur, but generally speaking, if you can intervene earlier, just from a financial aspect, do you see that as a benefit to your patients?
The earlier the better. Absolutely. Because little ones are so malleable, right? We can make such dramatic changes so quickly the younger they are. We know that there's no window for recovery, but the sooner we can get to your kid, the better. And if we can avoid an autism diagnosis altogether, it only makes sense.
Right.
So 949
Yep.
skin sample. How long does it take to get results on that?
Literally within weeks. We're kind of looking in the 3 to 5 weeks.
Okay.
It is could be faster than that, but we like to tell. We'd rather what is it? Under promise and over deliver.
There you go.
But you ballpark 3 to 5 weeks, and I know other diagnostics that are looking 8 to 12 weeks.
Oh yeah, yeah, for sure. A lot of genetic
So,
tests and other things like that are taking, easily 8 weeks, if not more.
right.
So if a family is interested in having this test done for their child,
Yep.
what do they do?
They call Dr. Sonia.
Yeah. So if you're in Missouri and you're interested in this test, definitely it's something that I will be offering.
Well, even so, do you work with people remotely, Dr. Sonia?
So I can do educational consults with people who are not in Missouri via telehealth,
Sure.
but even if they live, if they're in Missouri but too far to drive, we can do telehealth visits.
Sure. Yeah. So my recommendation, contact Dr. Sonia. Even if you're outside with our collection partner, we're able to reach about 98% of the US.
Wow.
Yeah.
That's amazing. And there will be a small fee for that nurse to come collect that
Sure. Yep.
visit. Okay. All right. So if this comes back on your child as having an increased autism risk, how can this change what a family does in terms of
Sure.
decisions? Like what things might they do or
Yeah.
not do?
Yeah, and kind of going back to what I shared earlier, it doesn't, what it says is that the risk is detected. And we as a diagnostic will say, hey, talk to your provider. Because I've gone to a lot of MAPS, right? And you're a MAPS trained physician. If you guys don't know what that is, MAPS is Medical Academy of Pediatric Special Needs. Dr. Sonia presents often at this very elite community outside they're more your functional integrative practitioners. And so all that being said is what we do is we defer to the practitioner, right? Because there are certain things that based on some people want to, hey, let's kind of, when we talk about how it was affected, how do we address immune T and B cells? Is it mitochondria? That's where you're going to work with your provider individually.
So I would foresee, if I had an infant and the risk was identified, it would change my thought process a lot about things like environmental exposures. Our kids are sponges for things like environmental chemicals, pesticides, herbicides. We also know that kids on the spectrum tend to not do well with gluten and dairy and sometimes soy. We know that kids on the spectrum have had injuries in their lives caused by medical procedures, whether it's sedation or other things. Wink, wink.
Right.
So if I had a child, it would really make me say, okay, I'm going to be super careful about what they eat. I'm going to be super careful about things like fabric softener and plugins in my home, right? The cleaning products that I use, the food that I feed them, the, sedation for procedures. Like that is a well-known trigger for certain kids. So this can really, I think, change the way parents think about how they handle their kids' everyday life, their medical care, all of that.
Yeah. And then that's where we kind of say, hey, talk to your provider.
Yeah.
100%, because you're what you do is going to be different than other providers as well.
Yeah.
So, and that's where we kind of we work with a lot of different types of providers, and some will choose A, and some will choose B and C, and some will choose all of the above.
So this just
but
came to me.
yeah,
Go
go
ahead.
ahead. No,
Do you
but what
have?
we are doing is giving you that tangible
Yeah.
information.
And objective. I love that there's no interpretation about it. It is, or it is
Right.
not.
Right.
Do you have any plans to maybe create a provider directory, a clinician directory of those docs who are trained to recommend and provide this test?
Yeah, I mean, the channel that I work with are your functional integrative, really those people that are the med maps, the maps providers.
Mm-hmm.
You have people that are working elsewhere, but yeah, I mean, the more providers that start coming on board, because not everybody is, hey, if I have a 3-month-old that comes out with this risk detected, what do I do? Well, maybe they see this and say, hey, let me contact Dr. Sonia and collaborate with her.
Yeah, gotcha. So what excites you personally the most about this test and the technology that it uses?
I have been to, like I said earlier, I don't know, 25, 30 autism conferences, and just having the interaction with the parents, that early intervention leads to brighter futures. And if I can help be a tiny little part of that by just reaching out to providers, educating providers on, hey, this is what we have to offer and this is how it's different. I mean, that's kind of my goal in the world, is can I make the most positive impact?
Yeah.
I'm not a provider. I'm not as smart as you. So, but if I can make that impact, that's what drives me.
Yeah. Well, and I tell you, I see kids and families all day in my clinic. And the thing that I hear them say all the time is, if I had just known, I wouldn't have fill in the blank.
Right.
If I had just known, I would have made such different decisions for them. And so I think, when you told me about this for the first time, that's the reason it lit me on fire, because I'm like, this answers the statement that parent after parent says to me, if I had only known. This gives parents a way to know in advance with very, specific, reliable information that can change the path forward. And so that's why it's just important for me to help you get the word out, and to also offer this test in my clinic so that, we can change the path forward for these kids.
Yeah, absolutely. And what you just shared is one of the reasons I came to you first.
Right. Yeah. Because how many thousands of families between us have we talked to who would give anything? I mean, they love their kid no matter what their diagnosis, but autism is hard, and we can change the path for sure.
Absolutely. So,
all right. So if people want more information, do you have a website? What
it's NeuroCure. That's cure with a Q. NeuroQure, neurocure.com. And what I would recommend is, thank you, and perfect. And if look at it, have any questions, reach out. You can contact us, but I would recommend reach out to Dr. Sonia and team there at Covenant Wellness.
And are you open to people emailing you if they have questions?
Absolutely.
Okay, let me put your email address up here real quick. So make sure I got that right. It was from memory.
You did.
So, okay. Yep. So especially doctors, if they have questions about how they can incorporate this into their practice, that would be especially applicable.
Yeah, absolutely. And for those providers that are out there, I would be your dedicated person, because you can have the best product in the world, but if you don't know how to communicate its value to your patient base, if you don't know how to integrate it into your practice, it really doesn't matter. So, and that's where I really take that personal responsibility to, because it's all about the kids. It's all about the families.
So this is very exciting. It's big stuff. Like it's a really, really big deal. I've been in autism long enough and I've seen all the shiny things come through, whether it was secretin, whether it was facilitated communication, whether it was ABA, whether all the things, right, that have come over the last several years. And I really, this is a big deal. So, any last thoughts or any last things you'd want to share for parents or professionals who are watching?
Trust your gut instinct. If something seems off, pursue it. Don't, hey, I'll, you know, unlike maybe taxes and waiting until April 15th. Man, if you see something, you have that concern, or maybe you have a sibling, right? We know that if older sibling, there's a 7-fold increase for those younger siblings to have the diagnosis. Act early.
Yeah. So if you've got already a child with autism, you want to have another child, this test is extremely applicable for them.
Right. And this is not prenatal. This is only for that child. So this is, again, literally within days of birth, we can do the sample. And again, it doesn't have to, you didn't miss a window. If your child is maybe 2 years, still a great time.
Awesome. All right, everybody. Thank you for joining us. We've had quite a lot of people on our live today. So if you have questions, you can always email me, Dr. Sonia at covenantwellness.net, but Glenn is really the expert. So you can see their website, neurocure.com, or gwilhelm at neurocure.com. All of those links are in the comments. So if you're interested, if you're concerned about your child, if you're thinking about another child and you want to plan ahead once that child is born, we can help you kind of figure out what the risk is. So,
hey, real quick before we finish, Dr. Sonia, thank you for what you do. I'm a better person because I know you.
Really? Thank you.
Yeah.
It's absolutely my life's work. And I will die with my boots on the ground to help these kids. So thank you for that. Yeah. I'm a ball bag. I cry over every little thing. So thank you. I appreciate the work that your docs are doing, the work that you're doing to the more kids we can help, the better. So, all right. Very good. Thank you so much. All right.
Okay. Bye.
Bye.